this time, unfortunately, we don't actually know. In both the Moderna and Pfizer trials, the placebo and vaccinated groups were tested for COVID-19 only if they exhibited the symptoms. And so from those results, we were actually able to conclude that the vaccines helped protect people from the occurrence of symptoms and severe disease. But unfortunately, what we don't know is the asymptomatic cases and the potential of patients that were vaccinated that could potentially still spread the disease. So the emergency use authorization was given because we know how complicated COVID-19 can get, how severely ill patients can get, and we know that vaccines do help protect people from that. But this is why the recommendation for the precautions of social distancing and masking still stand, is because we still don't know whether or not these vaccines help prevent the spread of disease. And so, we're studying this in real time. There will be more to come, and we'll have a clearer picture as the trials kind of continue and we continue to look at this. So with the trial results, we know that after the first dose, we get some immune response that's elicited, but the second dose really brings out what we know as more of a robust response. And this is where we see that dramatic increase in the neutralizing antibodies, as well as the T cell response. And this is what we know as memory within our immune system. And that indicates typically long-lasting or sustained immunity. We can't quite say how long this will last. Is it going to be a year? Is it going to be 2 years? That specified amount, again, is being studied in real time, just because these are new vaccines, and they're monitoring it, and we'll get a better idea. But the good news is that we are hearing about these new strains pop up. This mRNA technology doesn't actually depend on growing weakened or dead viruses in large batches to create more vaccine. This mRNA, with the strains that potentially the vaccines don't protect against, we can tweak it just slightly and produce newer vaccines much more quickly in the future if needed. So Dr. Manu Prakash and his team are actually currently testing a saliva test that they've developed, and it's called the SNAP-Dx test. And this is a type of molecular test that actually amplifies the genetic material that could be potentially found if you are infected through an assay called reverse transcription loop mediated isothermal amplification. It's a mouthful, but this is in comparison to the gold standard, which is the RT-PCR test. And in both of these tests, what we do is we look for genetic material of a virus, and then that's amplified multiple times to potentially detect it in your sample that's given. And so the way that this RT lamp works is that you don't actually need constant changes in temperature, which the RT-PCR requires. So it requires repetitive cycles of heating and then cooling, heating and then cooling. This particular SNAP-Dx test actually is isothermal, meaning it can be amplified at a constant temperature. And in this particular test, it can be done in the luxury of your home. So the hope is that the saliva test is going to be cheaper, efficient, and reliable, and can be administered and resulted within your home. And the way that it works actually is you collect your sputum in a collection tube, and that tube itself already has all the reagents and primers and DNA polymerase within it. And so you place it in boiling water for a few minutes, and that will kill off any active virus, stabilize the RNA if you are infected in the collection tube. And then you take it out, you cool it for another few minutes, and then with a simple manipulation of the collection tube, that a mixture of the enzymes as well as the primers are released. And that sets off the chemical reaction that will start to amplify the genetic material that could be potentially in your sample. And once it detects that and that there's enough RNA that's amplified, there is a color change that will happen. So you can actually visibly see whether or not you have the virus within your sample. And so it's a really neat way to screen for COVID-19 in the luxury of your own home. So you don't have to stand in lines, potentially not expose other people as well. When we talk about nasal versus sputum samples, it's actually important to differentiate the technique that's being used to detect the virus within the collected sample, whether it's from a nasal swab or a saliva sample. So the two types of diagnostic tests that are used are, one is the molecular test, and this includes your gold standard, which is the RT-PCR, and also now the RT-LAMP assays, as opposed to the antigen test, which is the more rapid test that we're seeing. And the RT-PCR and RT-LAMP assays look for genetic material within your sample, whereas the antigen test looks for a specific protein that's found on the virus. And so between those, the antigen tests are quicker, but they do have a higher chance of missing an active infection when compared to the molecular test. So that's why the molecular tests have become the gold standard. And so when it comes to actually within the PCR test, oral versus nasal swabs, a recent systematic review was just published in the Annals of Internal Medicine just last week comparing the two. And they did find that the detection rates and the sensitivities were actually quite similar as long as the molecular test was being used. And for this particular saliva DX test that's being developed right now, they're actually currently studying the reliability of this. So they will be looking at the percentages of false negatives, the percentages of false positives, and how reliable it is in comparison to what's out there already. This study was actually came out of WashU in St. Louis, and it was a small but double-blinded randomized controlled trial that looked at 152 patients in an outpatient setting that had COVID-19. And what they looked at was a group that got a placebo medication, and the other group got fluvoxamine, which is a selective serotonin reuptake inhibitor, traditionally used in mental health illnesses like OCD, anxiety, and depression. And interestingly, what they found was that the group that received fluvoxamine actually had no cases where patients deteriorated clinically. And how they defined that was development of shortness of breath, hospitalizations because of shortness of breath or pneumonias, or oxygen saturations dropping below 92%. And so 0 patients out of the fluvoxamine group actually clinically deteriorated, whereas about 8.3% in the placebo group that did not receive this medication were found to deteriorate. And so it is an exciting development, I think, mostly because we don't have very many medications that are being used in an outpatient setting just yet. SSRIs, we do know, have anti-inflammatory effects, and it's thought that they potentially could dampen the cytokine storm that we see in COVID-19 patients. So it's a study that is being welcomed, but we do have to remember that the sample size was quite small. It was a single center study. And so my hope is that we'll have larger trials kind of continue the study and potentially look at the reliability of this test, whether these results are reproducible, and that can offer a more definitive stance on whether this medication can be used in the future.